Today's announcement will be taking the place of my usual COVID-19 update. While I don't have all of the case numbers for you right now, I can say that we identified 1,887 cases yesterday and completed over 20,000 more tests for a positivity rate of greater than 8%. There are 716 people in hospital, including 136 admitted in the ICU. Sadly, another 15 deaths have been reported to us in the last 24 hours. My sympathies go out to all those grieving a loss today. As of yesterday, the reproduction rate, or R value, for the province over the last 7 days was 0.98. In Edmonton zone, the R value was 1.0. In Calgary zone, it was 0.92, and in the rest of Alberta, it was 1.01. So what does that mean? This metric of R describes whether the rate of transmission over the past week increased, decreased, or stayed the same. For example, if the R value is 1, then an infected person has infected about one other person on average. If it's above 1, the spread grew. If it's below, then we saw a decrease. What last week's values seem to indicate is that cases plateaued over the week. This is certainly better than an increase, but as the Minister mentioned, a plateau is not enough, and a single week's R value does not tell us about a trend. R is also not useful when looked at alone. We also need to look at our new daily case numbers, which remain high. What we need to achieve together is several weeks of an R value well below 1, with a corresponding decrease in new case numbers. At present, even with this single week plateau, we are continuing to see growing hospitalizations and ICU admissions, which are straining our health system. We all must keep doing our part to limit in-person interactions whenever possible. Like everyone else, I'm pleased to hear that we're receiving a large supply of the Pfizer vaccine ahead of the original schedule. This is good news and a little bit of hope during a difficult time. As the Minister announced, our vaccine distribution strategy focuses first on priority groups, long-term care residents and the critical workforce that cares for those in ICU and long-term care facilities. To be able to immunize residents of long-term care centres across the province, we need a vaccine that can be easily stored and transported to these facilities. We do not yet have the ability to do this onward transport from the sites that are receiving the initial shipments. That is why we're focusing our first doses on vaccinating crucial staff who work in hospitals and long-term care centres. This is with the goal to reduce the risk of transmission and outbreaks to those patients and residents who are at most vulnerable and most at risk of severe outcomes. To date, we have had more than 5,000 cases of COVID-19 in continuing care and acute care facilities across the province. Focusing immunization on workers from these areas first will have a great impact on protecting these facilities and those who live in or receive care in them. By immunizing healthcare workers first, we will also reduce one of the biggest stressors on our acute care health system today, staffing shortages. The isolation rules that apply to you and me also apply to healthcare workers, and all of us, including these workers, are at greater risk of exposure as our community transmission increases. This means when they are exposed to or contract the virus, they have to stay home until their isolation or quarantine period ends. Each time a worker has to do this, it leaves behind a critical position to fill in caring for patients or residents. This early vaccination of our healthcare staff will help protect both these workers and our system. It will help every Albertan access the care they need, whether it is related to COVID-19 or any other health issues. While this is exciting news, I do want to balance our excitement with the reality of the situation we're in today and will be in for months to come. The Pfizer vaccine requires 2 doses about 1 month apart to be fully effective. Worldwide demand for the vaccine is high, and we will be receiving limited doses over the next few months. It will be some time before we are able to immunize the general population. We are still many months away from seeing widespread protection against COVID-19, which means the steps we are taking now to slow the spread and bend the curve are still critical.